Teeth, they can be a right pain, can't they? Who can forget Tom Hanks in Castaway knocking one out with an ice skate? Oof. In this video, I'll talk about the association between gum disease and hip replacement infections. We'll also have a look at the guidelines on whether or not people who've had hip surgery should take antibiotics before having a dental procedure. Now, when I was a medical student, I worked for a cardiologist who'd been a dentist before doing medicine. Dr. Gribbin had a particular interest in bacterial endocarditis. This is a condition where the heart valves become infected. Clumps of infected material called vegetations stick to the valves. The vegetations interfere with the flow of blood in the heart and they can break off, causing a stroke. Gum disease is associated with bacterial endocarditis, which is why Dr. Gribbin was so fascinated with the condition. So why is this relevant to hips? Good question. I thought about Dr. Gribbin the other day when I went to the hygienist. I don't know about you, but I always feel like back at school again when the hygienist tells me off because of how much plaque there is. Then there's the horror of the ultrasonic probe, feeling like it's being pushed through my jaw. If you've got gum disease, then just like bacterial endocarditis, there is an association with an increased risk of infecting your hip replacement. Having said that, this is just an association. It doesn't mean that periodontal disease causes infection to happen. Periodontal disease is more common in people who smoke, who drink too much, and who don't pay attention to dental hygiene. All of these things are associated with an increased risk of complications after hip surgery. We need more research into this, but if I were going to have a hip replacement, I'd have a dental checkup first and deal with any problems before surgery. Just saying. Now, what happens if you've had surgery and you're going to see the dentist for a checkup or have some work done? Do you need to take antibiotics to reduce the risk of an infection? This has been a bit of a bone of contention over the years. Here's a summary of the generally agreed approach to this. Current guidelines generally advise against the routine use of prophylactic antibiotics for dental procedures in patients with hip replacements, except in cases where the patient has high risk factors for infection. This could include things like being on immunotherapy or diabetes. The recommendations are based on a balance between the low risk of infection from dental procedures and the potential adverse effects of antibiotic use, including resistance. However, individual patient circumstances and risk factors should always be considered in clinical decision making. The best thing to do if you're in this position is to speak to your surgeon and dentist. They'll know your medical history and significant risk factors. The take-home message is to look after your teeth and gums, have regular checkups and deal with problems promptly so that you don't have to get out the ice skates. Thanks for watching. Let me know if you have any questions or comments. If you want to get in touch, the details are in the description below. See you all again next time.